Welcome back to Epi in a Minute. In our first video, we compared each of the study designs and talked a little bit about the pros and cons of each. In this video, we're going to be taking a deeper look at case reports. Just like for each of the 5 study design types, the 5 C's, we're going to ask 4 questions. Number 1, so what is a case report? Case reports describe a single and unusual or newly discovered health outcome. Put together in a set, several unusual outcomes can be grouped together as a case report series. A case report describes the unusual outcome in great detail, usually including history leading up to the outcome, its treatment and resolution. In medicine, case reports are often written about an unusual new disease, like AIDS in the 1980s, or a side effect of medical treatment, like thalidomide and birth defects. Number 2, what are case reports good for? Case reports are great for describing the history, course, and resolution of a unique problem or disease. If a patient presents unusual symptoms, case reports are great for alerting other care providers who may be seeing similar problems and are trying to solve the problem one patient at a time. Case reports also activate epidemiological research to determine risk factors for the new disease, causing the other 4 C study designs. Number 3, what are case reports not good for? Case reports are uncontrolled, anecdotal reports that describe the experience of individual patients or groups of patients. They cannot do much beyond describing a unique situation. They can only speculate at potential causes of the new health outcome or which exposures might have an effect on that outcome. They cannot identify statistically significant associations, and they cannot establish cause and effect relationships. Number 4, how do we measure data in a case report? When describing a case report, it's essential to fully describe the signs, symptoms, and biometrics of the health outcome, and the basic epidemiologic elements of place, where did the case occur, time, when did this case occur, and person, what were the characteristics of the person or population affected. If you were to gather many cases together and compare them to other non-cases, you would have the beginning of a case control study. If you gathered many cases together and then did further studies or interviews with those cases, you would have the beginning of a cohort study. But just the way they are, case studies are a great way to describe an unusual or unique occurrence in an individual or population. Up next, take a look at the video for cross-sectional studies.